Well, for the latest on the fight against COVID-19 in South Africa, I'm now joined by Professor Francois Venter, who's the Divisional Director of Ezintsha at the University of the Witwatersrand. Thanks so much indeed for joining us. Welcome to the program.
Hi, everyone.
All right, so Prof, how are we doing? What's your assessment of our battle against COVID-19?
I think it's early days still. I know everyone's sick of hearing that at the moment, but it really is early days. We're seeing this rise in the Western Cape, which is very worrying, and I don't think it's just simply because of testing, better testing in the province. But it's so early on in the epidemic that I think it's anybody's guess as to where it's going to go. I think it's way too early. There's a lot of hope, and I think people are clinging to all sorts of different, everything from climate to the youth of our population to somehow protect us. But I just think it's way too early to tell anything.
All right, so you say too early. Give us a sense of a timeline, if we've learned anything from other parts of the world. Patient zero was in March. What typically happens? What does the curve tell us will happen, and by when?
So South Africa is unique in possibly one way, not totally unique, but we're one of the few countries that locked down really severely and really early. So what's coming has been almost certainly delayed. I think the common agreement at this point is that the epidemic is going to hit us a couple of months down the line, probably around August, September at its worst, if it's as bad as we think it's probably going to be. There's so many unknowns at this stage, why some countries have been relatively protected, why some countries have been so badly hit. And then within, I see lots of graphs comparing countries from one country to the next. You'll see Germany next to Italy, next to the USA, next to Brazil. But even within those countries, there's dramatic differences in terms of how badly they've been hit. And you know what it reminds me of is of the HIV epidemic in the 90s and 2000s, when places like KwaZulu-Natal were absolutely decimated by HIV, while places like the Western Cape were relatively protected. So there's a lot we don't understand that's actually quite geographically located. It's not about being a South African, but much more about where you are at the moment.
So living conditions, human behavior is going to play a major role in how this disease moves around. Concentration in terms of density of populations, I guess, will also further exacerbate certain areas more than the others.
That's right, which is why it's a bit puzzling that the Western Cape is affected as badly as it is, because it's not like they're the only province that's got informal settlements that are densely populated or people living on top of each other. And I think that there's a lot we don't understand yet. That's not simply about living on top of each other. That obviously is a major, major risk factor. And then the other huge things we don't know. We don't know about what's going to happen to a large HIV population. Are there climate issues that are going to play a role? We're just about to enter winter. What's that going to do to all of this?
All right, so what do we do then if we're sort of marching along with unknowns? Are we week by week changing strategy, or what does one do?
So I think it's really important for government to be nimble and also to course correct. I don't think anybody can expect government to get this right in any circumstances. We're just really in uncharted territory. However, it really does need to course correct. And I think one of the things that is being debated at the moment is to relinquish the extent of the lockdown, to rather focus on the social support and the social distancing measures rather than on this intense sort of stay-at-home policy, which is starting to hurt the rest of the healthcare services. We're starting to see people not coming forward for TB, HIV, vaccinations, women for antenatal services. We're also seeing the security apparatus being used in a way that's not helpful. So for this afternoon in Soweto, a whole lot of antiretrovirals were confiscated by the police, and the health staff who were trying to provide services were threatened with arrest. So these kind of over-the-top responses from the security forces are not helping the general health population. The biggest weapon we have here is social, for the communities and the society to get behind the social distancing, the hand washing, the kind of queue management, the wearing of masks, trying to work out creative ways of distancing ourselves and keeping each other safe. What's not helped is by these kragdadigheid sort of iron fist approaches that seem to be an unfortunate manifestation of much of the support at the moment.
All right, so if I'm hearing you correctly, you're saying that perhaps the lockdown has gone beyond its usefulness in terms of slowing down. We should be at the next phase now, which is what Professor Gray has been saying controversially, that we need to be focusing now more on taking care of the vulnerable and, I guess, educating people about social distancing.
I don't think it's actually that controversial. There's almost no one I know who's actually who knows about this stuff who's actually arguing that. I think none of us argue that the initial lockdown was necessary. In terms of how severe it was, maybe we can debate that, but I think it bought us time. I think what we're arguing at the moment is that we're not being served well by continuing it. As I said, course correcting is fine. Admit it was, there's things that we may not have got perfectly right, but then alter them. Don't cling to them going forward. And at this stage, for me, the most important thing is to make sure our society is kept safe. Like you say, the vulnerable are supported. People are hungry, are given food. People are old or vulnerable, are kept behind doors. And then start thinking creatively about how to deal with getting people back to clinics in as safe a way as possible. How do we deal with public transport that keeps, on the one hand, keeps the society functional and keeps people having access to healthcare, but on the other hand, also keeps people safe.
All right, so how far away do you think we are in terms of a vaccine? I mean, we keep hearing research is being done there and work is being done there. We've got this BCG story that's being tested because of its ability to deal with respiratory issues. From your experience and having seen things over time, I know that this is completely different, but how long do you think we might have to live without a vaccine?
So I have a warning, which is that in the HIV world, we were promised the vaccine 30 years ago, and we're still waiting. Wow. There are promising ones being developed. From my vaccine friends do tell me that because of the nature of the coronavirus, it's much more amenable to developing a vaccine. It's much more stable, and they're much more bullish about this. And I think the 18 months timeline is possible with a little bit of luck. However, we're not going to be at the front of the queue. We're down south. We're not rich. We're a lot poorer now. So for us to put up our hands and say we deserve the vaccine is going to be a tough ask. We don't have internal capacity to manufacture the vaccine. We're going to almost certainly be reliant on international manufacturing. In a world where places like the US are asserting that they need to be in the front of the queue. So we need to have option B, option C, option D in the background in case this vaccine firstly doesn't work or that it's delayed in terms of getting to us. And when it does get to us, we probably are going to have to start thinking about who gets prioritized, who is the most vulnerable in the society. And that's likely to be the elderly, healthcare workers, people who really are likely to be highly exposed or to be highly vulnerable to what's going to happen to them.
All right, Prof, we're going to have to leave it there, unfortunately. I could talk to you for hours over this, but hopefully we'll have more conversations in the coming days. Thanks so much indeed for your time tonight.